Good evening, Malden, and welcome back to another COVID-19 update. I want to thank our panelists, as I always do at the outset. We have Chris Webb, the director of our health department. We have Christian Lanphere from Cambridge Health Alliance. And then, of course, we have Dr. Kourtney Nickerson from our Board of Health. We also want to say thank you to Ron Cochran, our communications director, for working alongside UMA, Urban Media Arts, who used to be known as Malden Access Television, for helping us to make this event possible. Now, you may be asking yourself, why are we back? Because we now have the vaccine, and I think all of us feel on this call that it's more important than ever that we keep the lines of communication open and we keep our guard up. So that's the reason we wanted to have tonight's show, is to let you know that despite the advances that are being made, we must continue to work together to get through this. So as we always do, let's turn it over to our panelists to make a few introductory remarks. And then, of course, the most important feature of tonight's show is to hear from all of you. So without further ado, we'll go to Mr. Webb. What's the latest caseload and how are we doing?
Well, all things being equal, I think we're doing well. We could be doing a lot better, though, as usual. We always want to be the best at what we're doing as comparison to other communities, and we are still holding our own. But these spring breaks and the holiday and the change in the weather and the variants have caught up to us. Right now, we're in the yellow zone. We have 27.7% per 100,000 case rate. Positivity rate, is 3.55 and creeping up on 4. 4 is a target point for our office. 5 is when we start looking at, and the state will too, start looking at rolling things back. So we really want to, do our fair share, get tested, keep our masks on, wash our hands, and disinfect surfaces whenever you can.
All right, and how do people get a hold of you if they have questions after the show?
I'm sorry about that. Yes, you can email me at cwebb, W-E-B-B, at cityofmalden.org. My phone number is 781-397-7049.
All right, thank you. Down to Dr. Nickerson.
Good evening, Malden. Thanks for having me. I'm happy to be back. Like Chris said, you keep doing a great job. Keep up the good work. It is hard. We're going on over a year now. And if you're eligible for a vaccine, go get it. If you guys have any questions about it or you're nervous, reach out to us. We're happy to help you make your decision or help you get the information you need to feel like you're making an informed decision about getting a vaccine. We do want to encourage you. That is one of our best defenses against the spread of COVID and to keep you healthy. So any questions, come on, bring them on tonight. So thank you.
All right, very good. And then finally, one of the benefits of having Christian Lanphere with us all these months is that we've developed such a good relationship that he was able to help a number of our teachers get vaccinated recently in Somerville. So I told him privately, now I want to join everybody on the call to say publicly how grateful we are to you, Christian, for all your help.
Thank you, Mr. Mayor, and I appreciate the collaboration along with, with you, with Chris, Ron, and Kourtney throughout this last year. What I would say is through the hospital system, we are seeing mild increase in cases, not much, but there is a concern that we are watching very carefully as cases start to increase. And I would say, in the words of John F. Kennedy, ask not what your community can do for you, but what you can do for your community. And what we can all do is continue to adhere to the public health guidelines that we've all been asked to do and do our part.
All right, that's a perfect segue, because now we're going to ask you, Christian, we're going to start with you. I can't tell you the number of people that are saying, I got vaccinated, yet the numbers seem to be trending up. What gives?
So I think it's, interesting that we're starting to see, a big increase in the younger population now becoming positive. I think that is expected. Given that they are much more mobile, they're traveling a lot more. I don't think that they're adhering to the social distancing as probably good as they could be, because we've been focusing so much of our efforts on the most vulnerable in our society. But we also don't know, we still have a lot to learn about the vaccines and sort of, do people who are vaccinated, do they run the risk that they can carry the virus and continue to transmit it to others? Maybe not get themselves sick, but maybe they could get others. And I think that is still ongoing. And so the best protection we have is to continue to vaccinate, social distance, and wear a mask where appropriate.
All right. Dr. Nickerson, you agree?
Absolutely. There's so many questions about the vaccine right now. One of the big ones is, are you able to get the virus and be contagious after you get it? It does protect you from getting sick. It is just unknown whether or not how it contributes to transmissibility. We're starting to get some promising data from our frontline workers that we're seeing cases dramatically drop off. So it looks like people may not be infectious after they've been vaccinated, but we really haven't set out and done those nice controlled studies to really validate those findings. So it's out of an abundance of caution. It's what we can do to protect our neighbor. So even though you've been vaccinated, that's awesome. Please continue to wear a mask and act like you aren't vaccinated, because we just don't know yet. And it's going to take a little bit more time for us to get the data to know what we can do safely.
All right, up top to you, Mr. Webb.
The only thing I'd add really is that once you're vaccinated, you really have to follow the guidelines until 2 weeks out, maybe even 3 weeks out, just to give yourself that little extra hedge on the bet there, because we're hearing about people who have been vaccinated who have become positive. And I think what we're going to find when that analysis is complete is that they were well within the first part of their 2 week period and hadn't, kind of loosened up a little bit. I know when I was I got my second dose, which was some time ago. I still do wear that mask, but even that 2 weeks was precious. You really got to value that, because after that you can relax a little bit, but you don't want to let the farm go. You can talk with other people. Like in our office, everyone's vaccinated, so we can talk. When it's us, we can talk with our masks off, and we don't have to worry about anything. That's the current guideline, but we wear masks in the office anyway.
Right.
That's because we're setting an example for others. And if you can, you should.
All right, let's go to the community. Let's see what's on their mind. Ron, what do you have first for us?
Sure. So let's obviously, as we always like to do, we like to remind folks how you can get in touch with us this evening. If you do have questions, I'll be actively looking at our Facebook page for questions, as well as the YouTube stream of UMA, and also over Twitter. I've published it there. And then last but not least, if you'd like to call into the show live, we're back to taking our live phone calls, and the number that you can, it's up on the screen now for you, 781-388-9394, and we will take your questions live in studio. So with that said, we'll kick off with a question we received over in Facebook. I have a change of employment that now makes me eligible for the vaccine. I cannot start the job without it. Unfortunately, I cannot update my info on the mass vaccination site, and it's difficult to get one at a local CVS Walgreens. Is there anything I can do besides just keep trying over and over on the site?
Mr. Webb?
Yes, they can call my office tomorrow and let them know that was the reference. If you can let them know to call our office, we will be able to set them up with something in the next couple of days. We'll try and get it as close to as they need to their employment date. We do have some vaccine coming in.
All right,
Anybody
then
else?
what would you prefer for the phone number that they use?
I'm sorry, 781-397-7049.
Anybody else want to add to that, or is that pretty much covered?
Nope, I think that's right. I think
Okay.
that staying in the community is the best.
Okay. What else do you have over there?
Well, we're going to go around the horn here. We do have our first caller in quite some time, so I'm excited to hear from somebody live. So we have Kevin. Kevin, go ahead. You are on the air with the panel.
Good evening, everyone.
Hi, Kevin.
How are you? Thanks for having us once again. Like I said, information beats disinformation and imagination.
Right.
This opportunity is for us to talk to people who don't. So I would like to say, first of all, I think that the city of Malden has been very transparent. I think the Board of Health I applaud all of you for your efforts. I think it could have been much worse, and I've seen much worse in other places. My concern, though, is with the state of Massachusetts and then some of the stuff that's coming out from the CDC. They say the cases are rising because of one variant in particular, which is B1.1.7, which is concerning me that there's such a rush to move the state to opening. But I see a lot of government is still not fully open. I'm not sure if I feel confident about my daughter going to school when DMV is partially closed, courts are closed, access to the governor himself is closed. So with the experts on the panel, my biggest question is, after receiving my second dose, how vulnerable are my children who haven't had any doses? What do y'all see as the numbers rise? Do you think the variants will turn into a pandemic too? What do they see as our future? And one last thing, I would like to thank CHA for making the shot problem-free. It was so problematic trying to use the state in order to schedule a shot. Being a member of CHA, they actually reached out to me and said, hey, come on in, get a shot. And that's how simple it was. We were so frustrated calling the sites and trying to sign up for shots because by the time you entered your information, that scheduling period had been taken. So you were back to square one. So I want to thank CHA for making it problem-free. My family is now much better, and thank y'all very much. I'll get off the phone and listen.
Thank you, Kevin. First, Christian, we'll cut that clip and send it to your boss tomorrow, all right? Let's go to you, and then we'll go around the horn. About the variants, what do you think?
Well, we, along with many other infectious disease experts, have tried to express concern and caution about how fast Massachusetts is starting to open things up a little bit more. We were early on concerned that this was maybe we're jumping the gun a little too fast. So, and we are still concerned about it. And I think we did recognize that there is likely a potential for a third surge. People were starting to relax. Things are warming up. And it looks like it's trending in that direction. I think we'll see how things go. If we can put these mitigation efforts in place, we'll stay at them, but we are concerned. I think as far as the variants, obviously we've been very worried about the variants. We've also had several patients who we've done genome sequencing on to confirm that they had some of the variants. I'm not sure that the variants have proven to be, the mortality rates have increased with them, but what they have done is that they have certainly become much more infectious. And that puts more people at risk and makes more people vulnerable, especially those patients who have other comorbidities that puts them at a higher risk for mortality. So there are concerns, and we recognize that.
All right, over to you, Dr. Nickerson.
So with the variants, I think what Christian said is really important to remember is that we're seeing a little more infectivity with them. So when variants are arising, it's when we're a little bit lax on our strategies to shut down the spread. So think about, when you're wearing a mask improperly or you don't wash your hands or something and something gets by. If they get an advantage, they're able to infect you even though you used precautions, and now they have a leg up and they can survive. That's when they're going to get a foothold. So you kind of think about, the risk and consequences of us opening up too early, and will there be consequences for variants like this to spread because they're doing a better job? And that's where you do get a little bit concerned. For the most part, we have to really be proud of Massachusetts. I think it's like an 86% vaccine dosage usage. So as they're coming in, people are getting them. So the demand is there. As frustrating it is to not be able to get a vaccine appointment, I'm also so proud of everybody that's like, I'm ready, give me my shot, because that's the fastest way for us to protect our community. And to touch on the schools a bit, because I hear your concern. I think it's something that we all worry about a lot, because how do we keep our kids safe? And I think some of the really important things to remember is that we're doing pooled testing for the schools. So we're keeping an eye on what's going on in the kids. And we didn't have that information before. We were depending on symptomatic cases to know if the virus was in our schools. And kids weren't really showing symptoms if they were infected. So we really didn't have any idea. And if you look at any of the state like dashboards for their case numbers and stuff, you'll actually see some of that data get separated out. And it's less than 1%, I think, of positive cases that we're detecting. But because we're detecting it, you can stop that spread. So there are active mitigation strategies in place. And then the teachers are eligible for the vaccines, they're getting them. So I think we have really good strategies in place to protect the kids and to get them back to that little bit of sense of normalcy where they're getting their good education in the classroom that they need. It's really a tough decision. It's a heart-wrenching one for sure, because we really want to be, at the end of the day, doing what we can to protect the kids.
Right. Okay, over to you, Mr. Webb.
Well, I agree with Dr. Nickerson on the school thing, and I'd just add that right now we're as we've entered into school, we're not quite all the way in yet, but we've had a very good track record. If nothing else, we have a very good track record on reporting, which is important, I think, more than just about anything. Because if we do good reporting, again, it's like contact tracing, we can stop the spread. So, and we've been, I think, really successful with that. As far as the variants, I would just caution people. Everybody's talking about letting your guard down and all that, and that's true. But what most people are doing, and I think where they're bringing the variants back, is during travel. Okay, you travel to the Caribbean, you're going to be with people from all over Europe, guaranteed. You're going to be exposed to virus that your body's not familiar with, and you're likely going to get sick or infected, and you're going to bring it back with you if you're lucky to get out of the country without a positive test. Right now, all around the world, if you have a positive test, you just quarantine in that country. So it can get expensive to go on vacation right now, and I would warn people that I think that's where a lot of the spread is coming from. Travel in airplanes, mass transit, whatever forms of transportation you have in other countries, just watch out. If you have to travel, travel. If you don't, if it's all it is a break for a tan, I would recommend you don't do that right now.
Okay, Kevin, thank you for that call. Let me just, I want to go back to you, Dr. Nickerson, with one question.
Well, before that, let me just add too about travel. The CDC still does not recommend flying, even if you're fully vaccinated, because it is a high risk activity. So just keep that in mind too, if you're thinking about traveling. So sorry to interrupt your question.
No, that's perfect, because I was just about to ask you, were you surprised to read that 1.5 million people traveled on Sunday? And if you were in charge, is that something you would look to not to be happening right now, or is that impossible as you reopen things that
so
you can't?
I am surprised that people are traveling, but I'm also not surprised because you know everyone's got cabin fever. We've been cooped up for a long time, and you want to see your loved ones. I know personally, family they were vaccinated and then they booked their flights right on up here, and
Right.
and I understand why. I want to see them too, but it is so hard to just say, you know, we're close, guys. Just a couple more weeks, couple more months, even, and we'll be at a much safer point. Hopefully.
Okay, Mr. Webb, let me ask you, if you had to rank it, do you now think travel could be one of the reasons, or do you still think it's family gatherings or houses of worship? What do you think?
I think it's mostly densely populated places. So whether that includes travel or not is you know, all in how you look at it. But let's call a spade here. You can't have travel and you know, not run into people from other locations with different variants. Your exposure level rises with that, and it's a gamble every time. Every night I watch the news, there's a horror story about someone being stranded in a country they went to for 2 weeks because airfare was low and the hotel rate was right, but then they have to stay there and they're paying the quarantine rate. It's not quite the same as the vacation rate, I can assure you. So I caution people, it's one thing to get infected. It's another thing to be sick just because you needed a break. We're close, June, in June, if you want to travel, take a good look at the positivity rate and you make a decision then. But until then, I wouldn't recommend it for anybody.
Mr. Lanphere, would you allow traveling the way it's happening right now, or?
Well, I think, I certainly wouldn't be, there's certain destinations I certainly would not be going to. I think we all know where those are. Obviously, where mask mandates have been significantly relaxed. We're also seeing the variants are going up. I think that Europe is becoming a growing problem once again. We are watching what's happening in Europe, which could very well translate to here. So it's happened both in the first surge, the second surge. Europe sort of was clearly the indicator of what's to come. So I do think that we need to take a step back. We need to settle down, and let's just try to get through this as we continue to vaccinate people as much as possible. But I do think that our public health and our healthcare colleagues are exhausted, and I think we've got to give them a break at some point. All
right, back to you, Ron. What's our next question?
Yeah, I think we're going to go right into the vaccine questions. I'll kind of collect a few and ask them as one. The first is just about which variety of vaccine you get. If you were making a choice, what's the difference between them? And then we'll follow up with another vaccine. So why don't we send that one to the panel first? So choice of vaccine, which one? What are the differences between them?
Who do you want to go with first, Ron?
So why don't we go as I'm looking around the horn here? I'll start with Christian first.
We get this question a lot. I think that there's I call it brand envy. I think that all three vaccines actually have, I think all three of them are great. I don't think any one of them are better. I think, for me, it really comes down to storage and management on the vaccine provider's end. I think for some people, maybe the one dose Johnson & Johnson is better. But I do think that I think they all have similar, I don't think that any one of them is any better than the other. I think all three of them are very good.
Okay. Dr. Nickerson?
Yep, I would agree with that. I think the numbers are saying that they're 100% effective against preventing severe disease and death. So with that, you've got pretty comparable vaccines. I think, the J&J has an advantage because you're one and done 2 weeks later and you're protected. The other two, also great. 2 weeks after, you're about 80% protected. Then once you get that second dose, and a couple weeks after, you're good to go. So, if you can get an appointment, whatever you get, go get it.
Okay, Director Webb.
I'd agree with both of them. It's exactly right. I mean, it is a branding issue. Johnson & Johnson got a bad rap in the beginning, and some people are looking past those early numbers that were in the 50s, and because now they're in the 80s. So to be a vaccine and be in the 80 percentile for infection rate, you're doing pretty darn good. The others are a little higher, but is that overkill when they all do the same as far as protecting you against severe disease and death? I don't know. And the other thing is, again, a branding thing. I would love it, like Christian was saying, that if they were all one dose, it would be so much easier from a storage and administration standpoint, because believe it or not, second doses are a nightmare. Okay, it's a very difficult logistics thing to pull off every time, especially in the early days of clinics, because you never knew when the vaccine was coming again. We hoped it would be there, and generally it was. So, and oftentimes it was good work by the state covering. So now it's ready, it's coming. We're going to have clinics again soon, and I would recommend people take advantage of whatever clinic is available.
And just to be clear, the nightmare you're referring to is one of logistics and not of effects.
No, yeah, exactly.
Okay.
I have to say this too. I want to take a second just to thank everybody who's been to the clinic so far, because they've been courteous. We've had some fun. We like to think we run a pretty good, tight ship, and it's a good experience for everybody. We're always interested in hearing good ideas. We're going to have some music at the future ones, because We all know how it is sitting there for those 15 minutes. So thank you.
Now, I noticed none of you mentioned AstraZeneca.
I think AstraZeneca's got some, I think we got to clear up some questions before I think we can all get comfortable. I think the data out there, I think, we're driven by evidence and what data gets presented. I think there are questions about some of the evidence. So I think until that gets cleared up, I think there's going to be a lot of questions about it.
Mr. Webb, you were nodding your head too. You agree?
Yes. You can't, at this level of review, you can't make a mistake and put in data from 3 months earlier. You can't. That should have been checked and double checked, and they should have had their own review internally to make sure that every number that went out the door is correct. Humans being humans, it's going to happen, and we need them to, back up their science just one more time. And I'm hopeful. I would have liked it if it was a 1-dose vaccine, but I'm hopeful that it will get out there. Maybe if we don't use it in this country, it will be, very successful in other countries.
All right, Dr. Nickerson, you were saying earlier, if you can get it, do it. Does that include AstraZeneca?
So AstraZeneca is not approved for use in the United States right now, not even under the emergency use order. So it's really a non-issue. We are kind of listening, evidence driven, as Christian said, what is happening in Europe and elsewhere on the globe to see what's going on. The data concerns are alarming. But AstraZeneca is a good company. University of Oxford does a lot of vaccine studies and a number of really, really important vaccine trials. So I do expect there to be strong data to come from them. I'm just a little concerned that it is maybe not as transparent as it should be. So we'll give them a little more time to sort everything out, and hopefully we'll have a good product there. But for now, the FDA is looking out for us. We have 3 great products here available in the United States, 3 great vaccines that are doing a good job. So if you can get one of the ones that have been approved for emergency use, go for it.
So, doctor, people that are abroad or who go somewhere where that is available, you do not recommend that?
You're putting me in a tough spot because what we know here is that it hasn't been approved, and we haven't been able to look at the data critically ourselves. So being able to make an informed decision about whether or not it's safe and effective is, we're not in the position to do that. So you can trust the officials from the country that you're in with what they have available to you, or you can wait till you're here or wait till the scenario presents itself to get something that you've been able to review some of the data yourself and be comfortable with.
All right, very good. Back to you, Mr. Cochran.
I'd actually like to go back to a comment that Chris made, because I think there's a lot of value. At this level, you can't afford to make a mistake. And what's important is that there are still people in our society who are still have concerns about trust with the vaccines. And when the news media puts out their information that, maybe there are questions, it puts our jobs it puts us in a more difficult position to try to make sure that people know that, that these vaccines that are currently out there are good, valid vaccines. And we can't really afford to have questionable information that the regulators, are putting out there in a situation AstraZeneca's in. I think we need, they needed to really put the right information forward, as honest as possible, so that, when their review comes up, whether it's approved, that there is sound evidence behind their claims, because we still are struggling with vaccine hesitancy. And until we can get past some of these people and help them, can convince them that this is the right thing to do, we may not get herd immunity. So it does affect us much more broadly than just AstraZeneca putting an application in of itself.
Okay, thank you. Okay, Ron?
Yeah, so we're going to go back to vaccine protection, and in particular, natural immunity, because of, having been COVID positive. Maybe could explain the nuances between when a person who has already had COVID, when they should get the vaccine, and then some of the advantages. In other words, let's just say someone who is just coming off maybe within that early window, do they have protection to just the strain that they got? Did they cover variants and then they should get the vaccine? And then independent of that would be, when should they get the vaccine free of all those factors? What's the timeline?
Mr. Webb?
I would say that, you know, if you've had, if you've had COVID, you want to wait 90 days at minimum for that. I'm not sure I understood the rest of your question as far as separating one from another. I'm sorry.
So that's okay. So basically the gist of the question is, so say if you have, you know, you got COVID, you have natural antibodies from getting COVID. Now there's variants. The question is, are you protected from those variants, and would you then benefit by getting a vaccine to sort of like have an all-in-one approach, or are you already protected from variants because of natural immunity?
In the currently, it's not determined how effective the current vaccines are against the variants, but you have to assume that the variant has some of the characteristics of the original virus. So getting any antiviral or vaccine will protect you better than not at all, because I don't think the variants are as effective at getting through someone who's vaccinated already as someone who is not. You will definitely not be as sick. That much I do know.
Okay, anybody else? Christian or Dr. Nickerson?
Well, I'll just add to this. Like, think about the variants as like when you have a cupcake and you decorate it with sprinkles, and you can put different sprinkles on your cupcake. You're still going to get to eat a cupcake. It's delicious, but you know, the sprinkles are going to look a little different. So your body's going to make antibodies that are going to recognize what the sprinkles look like. And that's where you get some differences, you know, from the variants. And I'll show my age a little bit here, but it used to be when I was a kid, you'd have chickenpox parties, right? And you'd all go get exposed, and you didn't have a vaccine for chickenpox, but that's how you were protected. So we do know that there's some natural immunity from being exposed to the virus or having an active infection, but we don't know exactly how your immune response is handling it. And we think that a lot of the people that end up hospitalized are because you have an overzealous immune response. So there's a lot going on here with this virus that we don't know, because coronaviruses, or this type of coronavirus, isn't commonly seen in our population. There's seasonal ones, but they're a little different. So we're learning a lot as we go, and the vaccines complement any natural immunity you might have from being exposed. And it's really our best step forward in making sure that we do have a robust immune system and protection moving forward.
Christian?
I think I would follow what Chris and Kourtney said. I think they both said it very well.
Okay. Do you have anything else in the queue, Mr. Cochran?
I think that answers the main question. However, I had a very hard time focusing after Kourtney said cupcakes. So please, a different example later. But no, there is a couple more questions that have come in. So Kev, who joined us on the phone, had a follow-up question that he would like to ask. He asked us through Facebook, and he says, now that we have had the first birth of a child with natural COVID antibody, what does this mean for maybe a children's vaccine?
Dr. Nickerson.
So much good news, right, for kids. And I think independent of what we're seeing with expectant women or newborns, Pfizer, Moderna, I think multiple companies have announced their trials in kids. They're doing the safety studies to see if they'll be tolerated. And we just have to be careful, because kids have developing immune systems that can be pretty different from adults. So, you know, careful, critical look at that data, but it's coming. So we just optimism, a little more time, and we'll get that information soon, hopefully.
All right, our other panelists.
Well, I think Pfizer just came out saying that their studies showed children between the ages of 12 and 15 that there was 100% protection. I think that is huge, huge for that population. I think we all want to make sure that our kids are well protected, and I think this is just one further step to hopefully, particularly I think for the school systems into the fall, that there will be a hopefully vaccine in place to protect kids before they go back to school in the fall.
Okay, Mr. Webb?
I'd agree with both Dr. Nickerson and Christian. It's gone right around the corner. It is coming. That 12 to 15 news that came out, I think yesterday, was impressive. So, it's, think about it. Everybody still has to be in awe of this process. They really are working hard. And if you can't appreciate that, I'd recommend you read, any book about past pandemics. It will really put things in perspective for you.
So, Mr. Webb, let's say despite those advances, someone chooses not to get it. Do you think at some point this will be mandated?
I don't
Or
think
should it?
so, and I hope not. I don't think anybody should be told what medical procedures they should put themselves through. That should be a decision you make for yourself. But I would, and I can understand there are some people who have serious health concerns that won't get vaccinated because they just don't need to be concerned about one more thing, right? But I would caution those people that COVID is worse than any of the side effects that are currently known from any of the vaccines. So make your decisions wisely. I mean, there are religious concerns, there are health concerns, there are just lack of trust in the process, which I would really recommend people. We're going to be doing a lot of work in the next few months in the community, trying to educate people as to how the whole process came together so that there is less hesitancy and more people get vaccinated, and we'll facilitate that as well.
All right, Mr. Lanphere, should it be mandated?
So I think similar to what we've done, we are not making it mandatory. It's an emergency use authorization. These are not fully vetted through the FDA process. While we do require certain vaccines to work in a healthcare environment, this is not one of them. And I think that we don't, I think they're, until these are fully vetted and have some time, I think that they need to be something that people should be able to choose on their own.
Doctor?
Yep, I agree with both. And I want to encourage people, if you are nervous, you have questions, reach out to us, reach out to somebody that you trust, pharmacists, anybody in the healthcare system that can help you find the right resources or answer some of those questions so that you can understand what the process that this went through. Because it really is it's a sort of a modern miracle that we went from having a new virus identified just over a year ago to now having a vaccine that's protecting people from the most severe consequences of getting infection. So there are answers. We have data for different populations to get that transparency out there of, we want to make up for some of the mistakes that science has made in the past. There were things that were done improperly. It's not okay. We've learned from that, and we're still learning. So please, if you have questions, reach out where everybody's willing. I feel like everybody's eager to share what they know or to help you find the information that you need to be confident in the decision that you're making.
All right, someone just said they're convinced by your presentations. How do they register online? Where do they go?
I don't have an answer for you, Chris. I'm sorry. Or May.
What's the website address?
Right now, the best place to go, in our experience, has been CVS. Walgreens is coming online with more locations. I just don't know if Malden's going to have one of those locations yet.
Okay.
But stay focused. The masks, I think what you're going to see in the next couple of days, maybe into next week, maybe early next week, will be a really big rush of vaccine supply to the mass vaccination sites. So I would tell people that I know they're very concerned with the pre-registration process, that there's thousands of people in line. They're prepared for that. They're going to move those people through with relative speed. Like I tell everybody, the hard part of vaccinating people is not actually vaccinating people. It's everything that leads up to that point. For a 500-person clinic, it takes about 8 solid hours of planning, manpower, equipment, vaccine, all the things that go into it. And it's a lot of work. I've tried to make it easier and I can't. So I think it's imperative. I lost my train of thought. I'm sorry.
That's okay. Give the website though. What's the general? Is it mass.gov?
mass.gov/vaccine. Keep your eyes and ears open. We'll be announcing some local clinics soon, probably within the next day or two. We don't want to announce too early because we are doing a little targeted outreach to homebound people. So we're kind of focused there right now, just for the next day or two. And we'll get all our scheduling correct, make sure our information correct, and we'll get links out to the community, hopefully by the weekend.
Okay.
And, we have some good news. We are recipients of Johnson & Johnson. So the clinics will have Johnson & Johnson. We have a small amount of Moderna, very small amount, 100 doses that we need to move. So we will ask people to do that. And if we're going to add those to the ends of our clinic and make it easy for people to use, coming late at night and come again, we'll be there again in the evening so that they don't have to leave work. So
Mr. Webb, one more time, mass.gov/vaccine. Now, if they don't have access to a computer, what's the phone number, the general phone number?
There, you can call for the state registrations, you want to call 211. And if you need assistance, call 781-397-7049. If it's not during business hours, leave us a message. We will call you back first thing in the morning, and we will hopefully have found you something to register into. If we haven't opened it up for you, we will give you the access to it. So please don't hesitate, give us a call. That's what we're there for.
Back to you, Mr. Cochran.
Sure thing. I think it's probably worth, we're going to go to a question that Mr. Webb actually was sort of partly covering about homebound folks, because I know there was some discussion online that we wanted to make sure we covered. But before that, I thought it would be useful to just cover where we're at eligibility wise. So looking on the state's, vaccine website, as you suggested, we're in phase, right now we're in phase 1 and 2, and then phase 2, we're sort of in the middle of phase 2, right? So maybe you could talk about the dates and who's eligible on those dates. And I can probably have an assist if you need it, because I have the site up in front of me.
If you can give me the date, the first date is April 5th, I believe.
Yes.
That is going to be 55 and older with 1 or 16 and older, depending on the vaccine you get, 16 or 18 years of age with 1 certain medical condition. They changed the vernacular there, so don't get confused. It's generally the same list of medical conditions that the guidance had issued previously. Heart conditions, obesity, smoking, asthma, COPD, and liver malfunction. If you have a question, ask us. We'll tell you whether you qualify or not. And as it goes forward from there, I think is it the 16th or the 19th?
19th.
19th. That is when it's wide open. We're looking forward to seeing everybody. And just Kevin asked a great question earlier, and I made a note, and I want people to understand that city government, state government, the DMV aren't open yet, because the majority of those employees are in that age range less than 60. They have not had any access to vaccine whatsoever. So to bring them all together is not good public health, and it should be avoided at all costs. Thank you, Kevin, for that question.
And I think just quick little follow-up on that. I think the state covers it by saying 16 and older. Presumably, they'll direct them to the appropriate vaccine, meaning like one of them is 16 plus, one of them is not, right? So is that how it generally works? Oh, you're on mute,
vaccine
Chris.
they're getting at any clinic they go to, and if they're eligible for that vaccine. Those are the 2 questions they should ask no matter what.
Got it. Thank you for that clarification. I think the next question we had was, there was some discussion on homebound folks, and there was a question about Malden as to whether or not they opted out of a certain type of communication. So maybe you could clarify how we're approaching that in Malden and where some of that confusion may have come from.
Okay. I don't know where the confusion came from, honestly, but I did hear about this issue that was brought up online and immediately called the 1-800 number, spoke to a great operator there. She double checked and assured me that she read back my information. So the phone number was there, the information was there. If someone said we opted out, it was rumor. We were one of the first ones in. Keep in mind, Malden is part of the Mystic Valley Public Health Coalition. We get a little bit of a heads up because there's a larger group of us. So we were into that program from day one. Would we want to vaccinate our own people or not? And I think local boards of health drove that question and felt that it was important that we do our own people because we know where they are. As of today, we have exactly 100 people that will be vaccinating at home. We expect that to double in the next week.
So if someone were to, someone is homebound, they're watching from home today and they're looking, do they call you at the health department or should they call this 800 number for more easy
I would
flow
prefer
there?
they call us, honestly. It would expedite it. It helps us order our vaccine so we know about it that much sooner. My biggest concern is that if people are calling the state, and if that's the only option you have, then do that, please. They will get us the information, but there is a little lag. And I don't want to order vaccine and have people pushed out longer than they have to.
Okay, so that's just to clarify, that's 781-397-7049.
Correct. Or cwebb@cityofmalden.org.
Mr. Lanphere, someone's vaccinated. Do we know yet how long it's good for? Or is the jury still out?
No, I think the jury's still out. I think we'll probably find out in June when the first year of the clinical trials wrap up. And I think the data is then presented. I think we'll know more then. I do want to go back to just a clarifying question. For 16 and 17-year-olds that have to register, they're going to have to be directed. And I think it's important for people to understand that they have to be directed to a site that has Pfizer. Both Johnson & Johnson and Moderna are only authorized for people 18 years and older. So for Pfizer, it's going to be Pfizer's as young as 16, Moderna and Johnson & Johnson's up to 18. But I do think, I think we'll learn more about the vaccine and is this going to be a yearly thing? Probably sometime this summer. I think we'll know more about what that's going to look like.
All right.
I think
Dr. Nickerson, is it going to be enough with adults only to reach herd immunity? Or are we also going to need children as well? Or is it too early to say at this point?
Might be too early to say at this point because children are a large portion of the population, and with the variants we don't quite know what the dynamics are going to look like moving into the future. So time will tell. And then getting back to sort of these vaccines were approved under emergency use, which meant we don't have the long-term data that we normally do with other vaccines. So coming up on that year since the trials started will get us some good information. But corresponding to that, we've only seen the SARS-CoV-2 virus out in the population for about 1.5 years now. So we don't even know what the long-term effects of the virus are. So I don't want people to panic when you realize that these are young vaccines, but they're our best tool to fight a virus that we really don't know a lot about as well. So we have learned so much in just a very short time. A lot of good information out there and a lot more continuing to come in.
Okay. All right, Mr. Cochran.
We are clear on the docket right now. If any questions, I'm going to keep poking around to our different sources. Once again, if you would like to reach us, you can get us on the Facebook thread here, or you can comment on our on the YouTube live stream. We'll check that as well. And then, of course, if you'd like to call us live in studio, we are back up and running on that. That's 781-388-9394. So while I gather up and look for a few more additional questions, I'll kick it back to you, Mr. Mayor.
I don't qualify for any vaccine, but I pre-registered on the state's website. When do you anticipate someone would get a return call or an email back? Mr. Webb?
Only when their age group is eligible.
Comes up.
Yeah. The system reads that. It will hold you up. It's not going to matter when you pre-register. It's going to matter when you're eligible.
Okay. Let's go down to Mr. Lanphere. So there was a CDC report this week that a single dose of Pfizer or Moderna's vaccine was 80% effective in preventing COVID-19 infections. So this question was, if that's the case, should the United States just go all in on first doses first and hold the second, focus on the first doses across the nation rather than taking time out on the second ones,
So
if there's an 80% effective rate?
Yeah, it's a great question. It's something we actually struggled with as well. Of, we didn't, because of the limitations in the vaccine, do we offer one? But given that the FDA authorizes to be a 2-dose, we're obligated to follow those recommendations from the CDC, with the understanding that we don't know that if we only give 1 dose, and by the time that second dose is time, is there going to be enough immunity, or do we going to have to start all over? I think there were a lot of questions about that. And because the clinical trials were done with 2 doses, we're obligated to provide those 2 doses. I think it's interesting. I think the studies have got more that we need to ask questions about around what the CDC and what they've recently come out with, and why this is a change that was not really answered early in the process. But we're right now sticking with the FDA guidelines as they've been approved.
Dr. Nickerson, I'm in a group of vaccinated people. Am I still wearing my mask? What's your advice?
Has it been longer than 2 weeks since they all got their second dose? I mean, you could gamble, you could take your mask off. You probably want to still wear your mask for some time, because again, we don't know if spread is possible from people that have been vaccinated. We don't know if they can carry the virus. There is some data out there showing that it's not likely, that those numbers are really, really good and very, very promising to say that we're going to maybe overcome this. But until we have hard data and those studies have been done, I've read that there is they're currently enrolling college students now. Half will be vaccinated, half will be unvaccinated, and they'll be testing them, I think, daily to see if there's any transmission of virus in the vaccinated population. So the studies are being carefully designed so that we will have answers to that question. But for now, we just remember everything we do carries a little bit of risk, and wearing a mask cuts down on that risk.
Mr. Webb, I get my first dose at CVS. Does it matter where I get my second dose? If I get it at Walgreens or somewhere else? Or should you get it at the same place you got your first?
Well, we recommend everybody get vaccinated at the same place if they can. If you can't, then you want to make sure that, one thing, that you're getting the same vaccine that you got in the initial dose. That's really the only focus you have. We recommend mainly that people go back to where they were, because those doses are being accounted for. So in essence, your second dose is already coming. So
Okay.
Don't hesitate to register, for the second dose as soon as you're eligible. Sometimes depending on where you go, you can only go to the first dose. And once you're in the system and vaccinated, it will tell you when your next dose is. So CVS and Walgreens, I don't know if Walgreens does, but I believe CVS's program works that way.
Okay. All right, last call, Mr. Cochran. Anything else in the queue?
No, we are good.
All right, so why don't we wrap it up by asking our panelists where we're going? So let's start with Mr. Webb.
Well, we're heading into another series of clinics. Like I've said, we're just tightening up the schedule, dosages that we can give out during those things, and where we're going to do it. We will be looking for another venue because the schools are in use, and we've got a couple in mind. I'll be talking with the mayor tomorrow to make sure he agrees that they're the best ones we can use, and I think he will. And we will be pushing out that information through social media. I'm going to meet with Mr. Cochran tomorrow. He doesn't know this yet, and talk to him about that schedule and get it ready to ramp up and go for the weekend. So pay attention to your code red calls. It's not going to be about trash barrels. It's likely going to be about vaccines. So please pick up and be ever cognizant of the behavior of the people around you, right? Take care of yourself. Let other people worry about themselves. We are getting a few more complaints about people not doing the right thing. And while I appreciate the input, because it does tell us a lot, we're just trying to remind people, just protect yourself. Don't account for anybody else's well-being, please, okay? It's important that you just let people do what they're going to do, right, wrong, or indifferent. It's their choice. So pay attention. We'll be in touch really soon. Thank you.
All right, thank you.
If I may, is it possible that they pick up calls for both trash and COVID calls as well? Is that, I just want to make sure we're okay with that.
Well, honestly, considering the amount of trash work we do, I would appreciate it if you picked up both phone calls.
Okay, thank you.
You're right, Ron. Thank you.
All right, Dr. Nickerson, down to you.
All right. Well, thank you, everybody. Please stay vigilant. Wash your hands, social distance, wear your masks, get registered for a vaccine if you're interested and eligible. If you're not sure, reach out, ask us questions, find people that you trust, find trusted information sources to help you make an informed decision. We are here for you guys. We are turning the corner. There are brighter days ahead.
All right, very good. And then finally, Mr. Lanphere.
Well, I just want to thank again. I want to thank you, Mayor, and I want to thank Chris, Kourtney, and Ron. I think you guys are you're a great group, and I think Malden's in good hands. I would say that we're going to continue to keep vaccinating. And if the state has pinpointed this directly, there'll be a lot more vaccine available in beginning in April. So many more people have an opportunity to begin the vaccination process. I do think that we're going to see a bump, an increase in COVID numbers. I think if we continue to do what we're doing, socially distance, wear your masks, and get vaccinated, I think then we definitely have a better chance of getting out of this by sometime this summer.
Okay. All right, thank you. And on behalf of everyone on the call, I want to say thank you to them for never giving in. And I want to say thank you for doing the same. I think I was talking to Alonzo in the studio, and this could be our 25th or 30th show, something like that. And it's not something we want to do, but it's something that we have to do if we're going to get to where we all want to go to. So keep fighting the good fight. I know you get that, but our job is to make sure everyone out there gets that as well. So thank you once again for tuning in, and we'll see you again soon. Good evening.